Today, we are talking hormones, and today we're going to be talking about what are signs of hormone imbalance at any age. Welcome today to today's Autoimmune Table Talk. I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and creator of the Transform Protocol to transform autoimmune disease naturally. Hormones is a big deal, and this is for men and women. And many of you, how many of you guys in the audience right now, if you're watching right now, if you can tell me if you know that hormones has been a huge trigger of your autoimmune disease, or you know your hormone symptoms are a big deal in your health in general, can you type in the chat and just tell me a little bit about what some of the symptoms you already know are related to hormones that maybe even your physicians don't even believe it, and maybe people around you don't even believe it. Tell me a little bit about where you're watching from. If you can comment and let me know where you're watching from or what autoimmune struggles you struggle with, that's really great. I love talking with you, not at you. So it'll be really great if you guys can let me know where you're watching from. Give me a shout out. You guys know that our program, Transform Autoimmune Disease Naturally, is the juggernaut in helping people turn around their autoimmunity, covering the 5 pillars of my Transform protocol. You also, many of you know already that hormone balance is the number one usually the first pillar that I talk about. The other thing is there's many of you who've taken our program, My Hormone Masterclass. If all you're interested in is in turning around your hormones, My Hormone Masterclass is a great choice, right? And many of you are graduates of that program. And it's eye-opening, right? Just how important hormones are and how they actually can cause many symptoms that you don't even know are hormone related, are related to the hormones. What are the signs of hormone imbalance? And I'm going to start with the list with women. Remember, this list, even though I'm going into age categories, I do want you to know that if you have been that age and that symptom occurred to you, that's a check in your checklist, all right? So I'm going to start with around puberty, age 10 to 18. Even if you're not 10 to 18, you have a daughter who's 10 to 18, or you have been 10 to 18, think about these symptoms that are actually associated with hormone imbalance. First of all, how many of you around that age have irregular, frequent, or no periods? Okay. What about heavy, crampy periods? It's a sign of hormone imbalance. Okay. And then PMS. How many of you have suffered from PMS, irritability, moodiness, depression, anxiety, or even brain fog at that age, right? I remember for me as a teenager, that was one of the telltale signs that I didn't know back then, but now I know, was that I had never been anxious before. And suddenly right around 15, 16, anxiety became a big deal for me. So new onset of mental health symptoms around the teenage years is a surefire way to know that there's a hormone imbalance. Okay. And yeah, that looking back, clear as day, right? Now, what about skin changes, right? So how many of you around that time had increased worsening of skin conditions like eczema, rashes, okay? Also acne, right? Or redness, or some bumps around the outside of your arms, or infected hair follicles around the armpit, okay? Or the groin area, right? These are all symptoms clearly associated with a hormone problem, okay? And then what about oily skin? More oily skin. You never had oily skin before. Suddenly you start to have oily skin, and you're seeing in your teenager. That is a big deal. Now, think about the diet of a teenager. Can our craving for sugar and the types of food that we crave change with hormones? All of you that have been pregnant already know the answer is hell yes. Well, that happened even when we're a teenager. So when your hormones change, instantly you'll start noticing that your teens become, even if they weren't before, carbaholics. Okay. Do they have sugar cravings? Do they become the carbaholics, right? Are there stronger food preferences or aversions, right? These are signs that there's hormonal shifts that's happening in someone who is between the age of 10 and 18. Now, what about sleep changes? You think that it's just natural for a lot of teenagers to be night owls, but that's not necessarily true. A lot of that is hormonal. And we know it's hormonal for our teenagers where they start having insomnia at night, because we know it happens to us around perimenopause. Suddenly we have insomnia, and it's not like because we're night owls, we sure as hell want to go to sleep, but there are hormone changes that's triggering the insomnia. So onset of insomnia, trouble falling asleep, trouble staying asleep are clear signs that there is big hormonal imbalances that are happening. Again, not everybody going through hormone changes feel crappy. Why do some people feel worse than others? It's because there's an imbalance in these hormones. Okay. So that's what I'm talking about. What are signs that this isn't happening in the right way? And there's an imbalance in these hormones like estrogen, progesterone, testosterone, your adrenal hormones. What's happening, right? There's an imbalance. Now, think about also, a lot of people don't think bowel symptoms are related with hormones, and they freaking are. So, how many of you remember, and I remember this for myself as well, that chronic constipation, diarrhea, stomach upset, heartburn, bloating. Okay. How many of you had those symptoms when you were a teenager or are seeing it in your teen? Type it in the chat right now. Okay. Go ahead, type that in the chat right now because ding, 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 ding. Because do you know that hormone changes totally affects bowel symptoms? So a lot of times in the medical world, we call it like irritable bowel syndrome or something. And do you know that how many of you out there with irritable bowel syndrome knows at certain times of the month, it gets a lot worse than other times? If there's no hormone influence, why would that happen? Why would it worsen certain times of every month? Because there's totally a link between the hormone balance and the way the smooth muscle in your intestines even work. Yeah. And do you know there's even fluctuations in the gut bacteria certain times of the month that's based on hormonal shifts? So there's a lot of underlying triggers that's triggering even bowel symptoms in your teenagers, okay? And even when you were a teenager. Now, weight fluctuations. How many of you suddenly lost a lot of weight? Most of us gained a lot of weight sometime around 10 to 18. That dramatic weight shift absolutely can be a sign of hormone imbalance and even thyroid hormone imbalance. So weight fluctuations, don't think it's just because, oh, they became a carboholic and they gain weight. Well, why is this? Some people can eat a ton of carbs and other people don't, and they still gain weight. How many people just look at grass and they can gain weight? If that's you, that's hormones. That's not because you have a vision problem absorbing grass through your eyes. There really is a problem with hormones where some people will even look at grass and they'll gain weight. If that's you, type it in the chat right now. Now, breast tenderness, monthly breast tenderness is a really clear sign, and that can happen at any age. But young girls would notice that with breast tenderness, nuance that they didn't have it before. That can be a problem. Now, here's something that I want you guys, even thinking about yourself and thinking about your kids. If there is a family history of autoimmune disease, anybody in the family with autoimmune disease, okay, the likelihood that this 10 to 18-year-old is having hormonal imbalance goes up like fivefold from what I've seen. So pretty much when we work with clients in my hormone masterclass, or we work with clients in the Transform Autoimmune program, the likelihood that they're telling me their daughters have the same symptoms or worse is 100%. I've never seen it not happen because these things are hereditary. And there's a lot about autoimmunity and the genetics related to it that makes our girls more prone to having the same hormonal problems we did. This is why you have a special responsibility here. This isn't just about you, me, and us middle-aged women, right? We have a ton in the other generation below us that really is depending on us to learn this knowledge so we can intervene and help so the same thing doesn't happen for them, right? This kind of suffering doesn't have to continue. The other thing is, in this population, if you can balance our hormones early, what's the likelihood that's going to trigger autoimmune disease? Because as many of you already know, what happens is these big hormone fluctuations from high to low, low to high, these big fluctuations is a very hormonally vulnerable time to trigger the onset or the worsening of autoimmunity. So I'm just curious if you're in the audience right now and you know that your autoimmune issues started when you were a teenager, type it into chat. And even better yet, are some of the symptoms I just said resonating with you, that they were even there and that they were the signs of hormone imbalance that is related with why your autoimmunity got worse? Type it in the chat. Because you know what? I love when people say, you're right, Dr. Maggie, because here's the thing. That's what happened to me. So I can't make this stuff up because that's exactly my personal experience. That's also my experience dealing with thousands of people with autoimmunity and dealing with their daughters with autoimmunity. These are our personal histories, and these are the histories we're seeing repeat itself in our children. So that covers the age of 10 to 18. Was that helpful so far? And if there was a big aha in there, go ahead and type it in the chat, because a lot of people don't realize, like insomnia, weight changes. Oh, and I didn't even mention headaches and cyclical migraines. How many of you started as teenagers with that? Sign of huge hormonal imbalance and a big trigger of autoimmunity as well. So headaches, cyclical migraines, big part of this in this age group as well. If you like our training sessions and you've loved our videos, give me a thumbs up right now. Give me a heart. If you know anybody that could benefit from learning about the hormones, whether it's your daughter, whether it's your sister, whether it's your mom, type their name in chat right now, because sharing is caring, and raising awareness around hormones and autoimmune issues as well is a big deal. And that's share the love. Type their name into chat right now.